Oh boy, cold and dreary weather. We know it. They're called the winter blues. So sometimes it's bigger than just the blues. Is it a type of depression called seasonal affective disorder? Where Dr. Amanda Parrish with Cone Health Behavioral Health Services is here, and we're going to talk about this. So let's just talk about how normal it is to feel a little depressed this type of year, especially since we just had 2 weeks of snow and stuff.
Yes, it is very normal to feel a little bit more down and depressed this time of year. As many as 20% of Americans really feel like lower energy and lower moods in the winter months, and that's what we call winter blues. So that in itself is fairly normal, especially when you're stuck at home with all this snow that's been going on. However, the key difference, if you're feeling something more than that, is the duration and the impact. If you're just feeling like a lower mood, and that goes away after a few days, that's just what we call winter blues. However, if you keep finding yourself feeling those persistent low moods for most days, and it's affecting your daily life, then that's something more that we really need to look into. And that's something that could be called seasonal affective disorder.
All right, so let's talk about that some because I know there's some people who use like lights and all kinds of stuff to help their seasonal affective disorder. Let's just define what it is and then what we can do about it.
Yeah. So seasonal affective disorder, what it is when you're having symptoms that we see in depression. However, they happen consistently in the winter months. And then you feel yourself when spring and summer come on, feeling that relief from the symptoms. So the symptoms that you would be seeing, usually consistency in the winter months, would be like persistent low mood, loss of interest in the things that used to bring you joy, difficulty getting out of bed, low energy, fatigue, sleeping more than usual, changes in your appetite that can affect your weight, trouble concentrating. If you're having a few of these symptoms and they're lasting longer than 2 weeks, in the winter months or in the fall, when our days get shorter, there's less light, that is what we call seasonal affective disorder, especially if it's affecting your daily life. Like you're finding it affecting your work, finding it affecting how you're interacting with loved ones. That is when we call it seasonal affective disorder.
Yeah, it's more than just a tough Monday after Super Bowl Sunday. It's like 2 weeks, like what you said. There is a duration of time. And
Yeah.
how common is it?
Yeah, no, it's fairly common. Up to 10 to 20% of Americans can really be affected by this. That's when, they have the winter blues and just keeps going on and on. And I think like up to 1 in 5 Americans have some type of mental illness. So it's fairly more common than a lot of the general population thinks.
Okay, so I think it helps people to know that it's common, right? They're not the only ones feeling it. But let's talk about maybe some of the differences between what some of those symptoms are for adults and maybe for kids, or maybe some of them are similar. I don't know.
Yeah, no, that's a very important question. The symptoms in adults versus children can look quite different. So in adults, it's a lot of the symptoms that I had said earlier. We often see like the persistent low mood, loss of interest, low energy, sleep changes, difficulty concentrating. In children, the symptoms are more behavioral. You would, instead of like the low mood or sadness, you would see increased irritability. You'll see children are more sensitive to criticism. You'll see like a social withdrawal. A key clue for us as physicians, when we're looking at these symptoms in children, are changes in school performance, changes in their grades. That's a key clue to lock us in. Children don't always have the words to describe how they feel, so changes in behavior are often the first clue for parents and caregivers.
Okay. So if we're having these kinds of things, what kind of steps can we take to help those? Because it's not enough to just say, well, it'll be over soon. That's
Yeah.
not good enough.
Yeah, that is definitely not good enough. The first step, the first most important step is awareness. You need to pause and check in with yourself. Am I feeling more down than usual? Is my energy low? Have I lost interest in those things that I normally enjoy, especially in the fall and winter are consistently harder. And then you find that the spring and summer bring relief. That pattern matters. So there are things that you can do. There are several like evidence-based steps that people can take to get better. With seasonal affective disorder, One of the key parts of the diagnosis is that there's less daylight in the winter months than there are in the summer months. So, one of the things that you can really do to help you start feeling better is trying to spend more time outdoors. Even if it's cloudy outside like it is right now, spending that time outdoors really still you get that daylight. It helps with the daylight helps with the neurotransmitters that we think really affects this disorder. You get more vitamin D. Also, if you can't really get outside in the winter months, something that a lot of my colleagues love to do, we have this light box in our office. And what a light box does is that it gives you those like lux, the daylight. It gives you that daylight that you're really missing. And how you would do that is you can spend $20 to $40 on Amazon, buy a light box, and you would use it about 30 minutes each morning before 8 a.m. Have it about 2 feet away from you, and that will give you that daylight that you're missing. Some other steps that we can really do, you can stay physically active. Even seasonal affective disorder or not, even if you're just feeling low, exercise is very important for mental health. It's one of the most powerful natural antidepressants. Even gentle movement like walking can significantly improve mood. Other really quick things you can do: prioritize your sleep, reduce your stress. Anything that can really help with just your mental health is what we can do towards seasonal affective disorder.
What about if we need or someone in our family needs to talk to someone? What are the steps that we need to take for that?
Yeah, of course. So, help is absolutely available. At Cone Health, we offer in-person and virtual psychiatric appointments, making care more accessible. If you or a loved one, if you're worried about their safety or if their symptoms escalate to the point where you are worried about them harming themselves, you can call or text 988. That's the National Suicide and Crisis Lifeline for immediate support and local resources. You can also go to the nearest emergency room if you're worried about that. For Guilford County residents specifically, we have the behavioral health urgent care. It's on 931 3rd Street in Greensboro. And that is a mental health urgent care that's open 24/7. And they can provide immediate evaluation and next steps for you.
Okay. All right. So, seasonal affective disorder, winter blues, that's one thing. But how about we talk about caring for our overall mental health awareness? What kind of steps do we need to do on a everyday basis?
Yeah. So something that I like to tell my patients is that mental health, like wellness, is built through small, consistent habits. Um, the first thing that I like to tell them is challenge those negative, unhelpful thoughts. Our thoughts, our feelings, our behaviors, they're all connected. So learning to notice and gently reframe the negative thinking can really improve our mood over time. Another thing is to stay connected with your loved ones. Ever since COVID, we've really been experiencing a real epidemic of loneliness. So, regular connection through calls, text, even like just shared meals with loved ones. If you notice that someone that you care for has been withdrawing a lot, just sending them a text, giving them a call, trying to reestablish that connection is really important for our mental health. Other quick things you can do: protect your sleep. Quality of sleep improves your mood, improves your focus. Live an active and healthy lifestyle. Physical activity releases really good hormones and improves that sleep. Make sure you eat balanced, healthy meals and, engage in meaningful activities, hobbies, creativity, learning something new, purposeful work for yourself that makes yourself happy can really support your mental health. And
All right.
above all, yeah, go ahead.
Okay. Well, I was going to say, what about, parents and caregivers? Sometimes we're the ones that have our own like anxiety or our own depression, and we want to kind of shield our kids from that. How do we not, make it something that they're having to deal with all the time?
Yeah, that is such an important question. As a parent myself, I understand how hard this can be. The goal isn't to be a perfect parent, it's to be really intentional. You really acknowledge your feelings without placing any emotional responsibility on your children or on the ones that you're caring for, and really try to model healthy coping. If you need to, take breaks, ask for help, practice self care, and your children just seeing that and they can learn mental health resilience just through watching you, because they really do soak up everything that you do. But it's really important to really ask for help if you really need it, because we don't want to put those feelings on our children. And get that help early if you need that support. Taking care of yourself is taking care of your child.
Yeah, I think sometimes we as adults have a hard time doing that, right? Taking care of ourselves, we want to take care of somebody else. So thanks for giving us the permission, right, to do that. I so appreciate
Yep,
that.
you have my
If
permission.
if you need to maybe send this to someone else, maybe you need to listen to some of this again, this is going to be in the 2-year well-being section of our website.